Hey guys, so we're going to be doing a lecture on medical terminology that deals with the nervous system. This will probably be a two-part video, just so it uploads a little bit easier. And then it'll also go along with the pharmacology lecture on medications that are used to treat the nervous system. So we'll go ahead and get started. So the nervous system overview. So the nervous system consists of our nerves, right? And our nerves come from our brain and our spinal cord, and we have nerves all over our body. Whenever we touch our skin, that sensation of feeling like prickliness or a scratch or something like that, that involves the nerves. So the function of the nervous system is it helps to regulate and coordinate all of the body's activities. It can help detect changes, so either internal changes or external changes to an environment, right? It evaluates information and it responds to stimuli. So, the center of all mental activity, including thought, learning, and memory systems, include the nervous system. The central nervous system, or the CNS, which is the abbreviation for that, includes the brain, the spinal cord. It helps to process and store sensory and motor information, and it controls our consciousness, right? So, whenever we're conscious, we're awake, right? When we're unconscious, we're not awake. Okay. And then we have the peripheral nervous system, or the PNS. So this has 12 pairs of cranial nerves and 31 pairs of spinal nerves, and it helps to transmit sensory and motor impulses to and from the central nervous system and the rest of the body. So this is kind of how it breaks down, right? So we have the divisions of the nervous system. So one part of it is the central nervous system, which includes the brain and the spinal cord, and then we have the peripheral nervous system, which includes these cranial nerves and spinal nerves. So out of the peripheral nervous system, we have what's called your somatic nervous system. So this is a voluntary control. So if I make a fist, right, and I consciously make that fist, that's a voluntary control. So that's part of the nervous system, right? And then we have this autonomic nervous system, which is a sympathetic nerve and parasympathetic nerve. So this is an involuntary control. So this includes things like blinking, breathing, right? Things that you don't control, your heart beating, your body digesting, right? We don't have any control over that, external control over that. So then we have the afferent sensory nerves. So these carry impulses from the body to the central nervous system. And then we have the efferent motor nerves, which carry impulses from the central nervous system to the muscles and glands. And this can help to cause the target organs to respond. So if I want to grab a doorknob, right? Then I use these efferent nerves because it carries the impulses from my brain to my muscles to make that motion, right? So it helps to kind of target those organs to respond. So, um, and that's a very, very minuscule example, right? Because it does everything in your body, even those involuntary motions, right? Like blinking and breathing and your heart beating and things like that. The somatic nervous system, this provides voluntary control over skeletal muscle contractions. And this autonomic nervous system, or ANS, this provides involuntary control over smooth muscle, cardiac muscle, glandular activity, secretions in response to the commands of the central nervous system. So, again, voluntary, meaning that you have control over it, right? It's something that you do. And then involuntary, meaning that it's something that happens, but you don't necessarily have control over it. So the autonomic nervous system, these sympathetic nerves, this is a fight or flight response. So I don't know if you guys have ever heard that term, fight or flight, right? So that's if you're put in a situation, right? Um, a lot of times the example used is a dangerous situation, right? What is your response? Do you leave, which is flight, right? Or do you stand and fight. It's that type of thing. Okay. So responses include, but are not limited to, the constriction of blood vessels, increased blood pressure, and increased heart rate. So think of like an adrenaline jump, right? So it's going to make those blood vessels constrict, and your blood pressure is going to go up and your heart rate's going to go up because you're kind of in that sense of, where do I go? What do I do? Right. And then we have the parasympathetic nerve. So this returns the body to a more restful state. Responses include, but are not limited to, a decreased heart rate, um, increased peristalsis of the intestines, increased glandular secretions, and relaxation of the sphincters. Okay, so question: blank nerves carry the impulses from the body to the CNS, while blank nerves carry the impulses from the CNS to the body. You guys remember? I'm going to say B. Yay. So afferent nerves are sensory, efferent nerves are motor. Okay. Cells of the nervous system. So we have a neuron. This is a functional unit of the nerve cell. So there's three basic parts. We have the cell body, which contains the nucleus and the cytoplasm. We have the axon, which carries impulses away from the cell body, and some are covered with this myelin sheath. And then one or more dendrites, which conduct impulses towards the cell body. And then we have a synapse, which is the space between two nerves. So it contains little neurotransmitters for activation or inhibition of nerve impulses. So it's kind of um, it's kind of this little bridge. The synapse or the synapses is kind of a little bridge between um, two nerves that kind of make things work or fire or trigger, if that makes any sense. Okay, so here we go. So these are the dendrites, right? So these little like weird things coming off the nucleus, right? This is the cell body, this little bit of a darker area. This is the axon. These are these beads of myelin, that myelin sheath, right? And this is a nerve cell, this whole section right here. Okay. So then whenever you get down to this part, these two little, these dendrites, right? Um, don't necessarily touch, but this little synapse is what kind of, like I said, that little bridge between connecting. They don't necessarily touch, but they kind of connect with that synapsis. So then we have the neuralgia, which is the connective tissue. It helps to support the system of the neurons. It doesn't conduct impulses. It helps to protect the nervous system through phagocytosis. So phagocytosis, if you uh, need just a quick little rundown of it, I think whenever I think of phagocytes, right, I think of like a Pac-Man. So phagocytosis is the act of one cell eating something else. So it's so I think of like a white blood cell that goes and it eats like a bacteria, wrote that bacteria. So that's considered phagocytosis. So what this neuralgia does is it protects the nervous system through that process of phagocytosis. So there's different types of this neuralgia cell. We have an astrocyte, a micralgia, and this oligodendrocytes. There you go. That's a good word for you. Parts of the central nervous system, we have the brain, which is surrounded by bone, which is our skull, right, for protection. And it's enclosed in our cranium. And then we have our spinal cord, which is surrounded by our vertebrae for protection. So the brain and the spinal cord are surrounded by meninges and cerebrospinal fluid, and this is just more protection and kind of works as a conductor to the cerebrospinal fluid. So the meninges, this is part of the dura mater, right? So this is the outermost layer of the meninges. It's tough and it's a white connective tissue. It's found in the epidural space. So this is located outside of the dura mater. It contains supporting cushion of fat and connective tissue. And then in the subdural space, it's located beneath the dura mater, and that cavity is filled with serous fluid. And then we have the arachnoid membrane. So this is the middle layer of the meninges. It resembles a spider web. So that's kind of where the arachnoid part comes. And then we have a subarachnoid space that's immediately beneath that, and that contains the cerebrospinal fluid. And then we have pia mater. This is the innermost layer of the meninges. It's tightly bound to the surface of the brain and the spinal cord. Now we're working on structures of the brain. So we have the cerebrum. So this is the largest and uppermost portion of the brain. It controls our consciousness, our memory, our sensations, emotions, and our voluntary movements. The cortex is the outer surface, and it contains these little gyri or elevations and little succuli, which are little grooves. So it's kind of like these peaks and valleys of the brain. So if you've ever looked at a brain or a picture of a brain, you can kind of see like it looks kind of spongy, right? That's kind of what that is. There's a longitudinal fissure that divides the cerebrum into two hemispheres. So you have the right and the left brain, right? And then you have the cerebellum, which is attached to the brainstem, and this helps to maintain, muscle tone. It coordinates normal movement and balance. And then we have the diencephalon, which is located it's located between the cerebrum and the midbrain, and it consists of many structures, including the thalamus, the hypothalamus, and the pineal gland. The thalamus and the hypothalamus, these help to maintain like body temperature. It's kind of like a furnace almost for your body. Then we have the brain stem. So this is a region between the diencephalon and the spinal cord. It consists of the midbrain, the pons, and my most favorite word ever, medulla oblongata. This serves as a pathway for impulses between the brain and the spinal cord, and it controls many vital functions, including, but not limited to, respiration, blood pressure, and heart rate. So, those types of things that we don't have a ton of control over, right? So this is kind of what I was talking about with those little peaks and valleys, right? It looks kind of spongy there. So this is the right hemisphere of the brain and the left hemisphere because we're looking kind of in a mirror. So these succuli are these little like valleys, right? And then the gyri are the little like spongy areas. And we have the cerebrum, and then this is that fissure that divides it into left and right. Okay. And then this is the cerebellum. This is your brain stem, and then it goes down into your spinal cord. So this is kind of looking straight on into a brain. So then this is a cross section of the brain. So this is the hypothalamus. This is the thalamus, the pons, the medulla oblongata, the spinal cord, and the midbrain. Okay. So our spinal cord, this is a pathway for impulses that are traveling to and from the brain. It carries 31 pairs of spinal nerves, and it affects the limbs and lower part of the body. So question, which part of the brain enables you to read this question and answer it correctly? What do you guys think? It's A, the cerebrum. It helps to control functions such as memory. So good job. So pathological conditions that go along with the nervous system. So things that maybe go wrong with the nervous system, right? We have something called Alzheimer's disease. I'm sure a lot of you guys have heard of this. This is a progressive and extremely debilitating deterioration of a person's intellectual functioning. So Alzheimer's, it's a rough disease, right? It kind of robs people of their memories, their ability to remember who they are, who their family is, things like that. So my grandmother had a pretty bad case of Alzheimer's before she passed away, and it's really sad to see somebody go through that. Um, and then we have amyotrophic lateral sclerosis, or ALS, or maybe you've heard of it referred to as Lou Gehrig's disease. This is a severe weakening and wasting of the involved muscle groups due to decreased innervation. It usually begins with the hands and then it progresses to the shoulders, upper arms, and legs. And usually, somebody that has ALS is pretty well cognitively, so they kind of keep that mental clarity and they have those memories and that function and stuff like that. It's just the body that starts to deteriorate, the muscles and things like that. We have anencephaly. So this is the absence of the brain and spinal cord at birth. It's a congenital disorder and it's not compatible with life. So the baby wouldn't live with this condition. We have Bell's palsy. So this is a temporary or permanent unilateral, meaning on one side, weakness or paralysis of the muscles in the face. Okay. Brain abscess. So this is an accumulation of pus located anywhere in the brain tissue. Carpal tunnel syndrome. This is a pinching or compression of the median nerve within the carpal tunnel, which is in your hand, in your wrist. This is inflammation and swelling of the tendons that cause intermittent and continuous pain. So, question, true or false? The breakdown of the word anencephaly is an, which equals without or not, cephal, which equals skull, and y, which makes it a noun. Is that true or false? It is false. Good. So, cranium is the skull, and encephal means brain. So, it's just kind of a play on words there. Then we have a cerebral concussion. Concussions are a huge problem in like contact sports, right? Like football, boxing, MMA, hockey. My son plays hockey, right? So this is a brief interruption of brain function, usually with loss of consciousness lasting for a few seconds, and it's usually due to blunt trauma to the head. We have a cerebral contusion. This is a small scattered venous hemorrhage in the brain. So it's basically like a bruise on the brain tissue. And it occurs when the brain strikes the inner skull. So if you've ever, this was kind of a big thing when I was a teenager, but they were finding that a lot of babies that were dying, in their infancy or whatever, maybe suffered from shaken baby syndrome. So, like, somebody would get frustrated and shake the baby, right, to get them to stop crying or whatever. And their brain would kind of hit back and forth inside the skull and it would cause a cerebral contusion. And so that's swelling of the brain. It can cause swelling and inflammation of the brain, but it's basically a big bruise. So it's breaking all of those blood vessels and things in the brain. And then we have cerebral palsy. So, this is a collective term used to describe congenital brain damage that is permanent but not progressive. So, it's something that happens, but it's not going to necessarily progress past the point that it is. And it's characterized by the child's lack of control of voluntary muscles. So cerebral palsy, kind of just going a little bit deeper into that, we have spastic, which is damage to the cortex of the brain. So this makes muscles that are tense and very irritable muscle tone. And then we have ataxic, which is damage to the cerebellum. And so this affects equilibrium. And what equilibrium does is it helps you to keep balance. And then we have athoid, which is damage to the basal ganglia. So this is causes kind of the jerking motion, right? And then rigidity, which causes the child to be in a continual state of tension. So their muscles are just kind of always tense, right? And then mixed cerebral palsy, which is a combination of all of the previous three. And then we have a cerebrovascular accident or a CVA. So this is death of a specific portion of the brain tissue, and this is usually the result of ischemia in an area of the brain or a stroke. So it's a death of a part of the brain. Causes of this can be a TIA, which is a transient ischemic attack. So it's also known as a mini stroke. Cerebral thrombosis. So this occurs largely in people who are older than 50. So a thrombosis is a blood clot, right? Cerebral embolism. So an embolus, which causes an occlusion. So it'll like shut off a part or clog up a part of the brain. And so then it causes a stroke, death of that part of the brain. And then we have a cerebral hemorrhage, which is cerebral vessel ruptures. Okay. We have degenerative disc. So this is a deterioration of the intravertebral disc, which we talked about, I think, in week 1 when we talked about the skeletal system. It's usually due to constant motion and wear on a disc. and that's in your back. So we have encephalitis. This is inflammation of the brain. So a virus enters the central nervous system when a person experiences a viral disease such as mumps or measles, or through a tick or a mosquito bite. So it's just makes your brain inflamed. We have epilepsy. So this is a syndrome of recurring episodes of excessive irregular electrical activity in the central nervous system, which is also called a seizure. We have grand mal seizures. So this is an epileptic, seizure. It's characterized by sudden loss of consciousness and generalized involuntary muscular contraction, and it may be preceded with an aura. So what an aura is, if anybody's ever had like a migraine headache or something like that, sometimes you get an aura before. So if somebody has epilepsy and they suffer from grand mal seizures, sometimes they know kind of when it's going to start, right? So they'll have this aura, so like a bright light or uh, seeing like a halo around things like that. That's why it's hard whenever people have epilepsy and they like a strobe light or something can sometimes set off a seizure. So this it the seizure can cause your body to become like a really rigid, right? So it makes your muscles tense up. And then it can also alternate between tensing and relaxing of muscles. So this is also known as a tonic clonic seizure. And then we have a petit mal seizure, which is a small seizure in which there's a sudden temporary loss of consciousness. It only lasts a few seconds, and it's also known as absence seizures. So sometimes when little kids are maybe first being diagnosed with epilepsy, they sometimes will have seizures. It's not like you're, shaking and rigid and eyes rolling into the back of their head type of seizure. Sometimes they'll just kind of space out and like look off into the distance or something like that, or their foot will move while they're just kind of out of it. Sometimes that's these petit mal seizures, is kind of what that's characterized as. Then we have Guillain-Barré syndrome. So this is an acute polyneuritis of the peripheral nervous system. So the myelin sheaths on the axons are destroyed. So it results in decreased nerve impulses, so loss of a reflex response, and then sudden muscle weakness. And it usually follows a viral, gastrointestinal, or respiratory infection. Okay. So, question, true or false? A cerebrovascular accident is a misfiring of the electrical impulses in the brain. That's false. So, vascular means vessel. So, this involves lack of blood flow to the brain. Good job. It's all about that word play, huh? All right. So, then we have a headache, or cephalgia. So this is a pain anywhere within the cranial cavity, varying in intensity from mild to severe. Maybe chronic, something that happens over a long period of time, or something that comes on pretty quickly, which would be considered acute. It may occur as the result of a disease process. So what that means is like if you have something else going on in your body. So let's say you have um, like an ear infection or like strep throat or something, a headache could be part of that disease process. That could be kind of like a symptom or a sign of something going on. And these usually headaches are totally benign. You can take some Tylenol or ibuprofen, and they would go away pretty easily. A migraine headache, my least favorite thing in the whole world. This is a recurring pulsating vascular headache, usually developing on one side of the head. It's characterized by slow onset. So a lot of people that suffer from migraines can usually they kind of know when it's coming, right? It may be preceded by an aura during which sensory disturbances occur. So, like in my case, sometimes I get little flashes. It doesn't happen all the time, but sometimes I get little flashes in my eye, or I have like a little like floaty bright light thing in my eye sometimes, in my right eye before a migraine starts. My migraines are caused by all kinds of different things. It's definitely stress related if I don't get enough sleep, that type of thing. But mine is usually more on like my cycle, right? So like when I'm getting ready to start my period and things like that. So that's kind of my biggest trigger. And then if I get overheated in any way, that's kind of a trigger for me too. And then we have cluster headache. So this is a headache that's occurring typically 2 to 3 hours after falling asleep. So it's described as extreme pain around one eye that wakens the person from sleep. And then tension headache. This is a headache that occurs from a long endured contraction of the skeletal muscles around the face, the scalp, the upper back, and the neck. So it's just kind of that tension in those muscles around your neck that causes your head to hurt. This is an epidural hematoma. So this is a collection of blood located above the dura mater and just below the skull. And it's arterial bleeding, basically. Subdural hematoma. So this is a collection of blood below the dura mater and above the arachnoid layer of the meninges. So this is venous, meaning vein bleeding. A herniated disc. This is the rupture or herniation of a disc center through the disc wall and into the spinal canal. It causes pressure on the spinal cord or the nerve roots. Then we have Huntington's chorea. This is an inherited neurological disease. It's characterized by rapid, jerky, involuntary movements and increased dementia. It's something that's progressive, so it goes from one time to another, right? And it's a degenerative disease, so meaning that it breaks things down, and there's no cure for that. So question, what type of headache would be most common in a profession such as medical transcription, which involves being in the same position for an extended period of time? What do you guys think? I was going to say tension, but it may be all of the above. It's C, it's tension. So it's very important to take time to stretch the tense muscles around your neck and your shoulders and things like that as often as possible to minimize more pain and injury. Then we have hydrocephalus. So this is an abnormal increase of cerebral spinal fluid in the brain, and it causes the ventricles of the brain to dilate. So this results in increased head circumference in an infant with an open fontanelle. So open fontanelle meaning those bones in the skull, right, that aren't completely fused together. So if they have an increase of that cerebrospinal fluid, it's going to make the circumference or the size of their head bigger, and it's a congenital disorder. Then we have intracranial tumors. So this is a tumor that's occurring in any structural region of the brain. It may be malignant, meaning cancerous, or benign, which is non-cancerous. These are classified as primary or secondary. So what this means is if it's primary, that's pretty much the only thing going on. Secondary could be linked to something else that the person's dealing with medically. They're named according to the tissue from which they originate. So a primary intracranial tumor is a tumor that arises from the gliomas and the meninges. So a glioma is a malignant glial cell that are a support for nerve tissue. So glio or glioblastoma multiforme, I guess, maybe, is the most rapidly growing of the gliomas. And then we have an astrocytoma, which is they tend to invade the surrounding structures. And this is pretty much the most common type of intracranial tumor. And then we have ependymomas, which occur more commonly in children and adolescents. And it's usually encapsulated and benign, so it's pretty easy to remove. And then we have metastatic intracranial tumors or secondary tumors, right? So this is a tumor that's occurring as a result of metastasis or something metastasizing from one area to another. So we'll just say like somebody that has breast cancer, right? If it's not treated or not treated correctly, right, that breast cancer can travel or metastasize to other organs. So it can absolutely go to your brain, right? So that's a secondary tumor from some other issue going on in your body medically. So like breast cancer, lung cancer, skin cancer, all kinds of different ones. Okay. And then we have meningitis. I know how to talk, I promise. So acute bacterial meningitis. So not like, oh, how cute, bacteria. It's acute, meaning it happens pretty rapidly, right? So this is a serious bacterial infection of the meninges, and it can have residual debilitating effects or even a fatal outcome. And it must be diagnosed and treated promptly with appropriate antibiotic therapy. So true or false? Biopsy of a tumor in the brain shows cells compatible with breast tissue. This means it is a primary tumor. Think about it for a second. Just talked about it. That would be false. So since the tumor did not originate within the brain, it's known as a secondary tumor. We might get through this without it being two parts. So we'll just see where it goes. Multiple sclerosis. This is a degenerative inflammatory disease of the central nervous system, attacking the myelin sheaths in the spinal cord and brain. It leaves area sclerosed or hardened or scarred, and there's no cure for multiple sclerosis. And then we have myasthenia gravis. This is a chronic progressive neuromuscular disorder. It causes skeletal muscle weakness without atrophy and fatigue, and it's occurring at different levels of severity. And we have narcolepsy. So this is a rare syndrome of uncontrolled sudden attacks of sleep. The main features of narcolepsy are daytime sleepiness, and then a sudden loss of muscle tone. So if you guys ever, I know I use movie quotes or movie references a lot, but if you've ever seen Deuce Bigalow, Mel Gigolo, he dates a girl or goes on dates with a girl that has narcolepsy. So she like falls asleep bowling. Yeah, that's narcolepsy. And then we have a neuroblastoma. So this is a highly malignant tumor of the sympathetic nervous system. It's most commonly occurs in the adrenal medulla with early metastasis to the liver, lungs, lymph nodes, and the bone. We have Parkinson's disease. So if you guys have ever watched Back to the Future, the guy in that, his name's Michael J. Fox. He has Parkinson's disease. It's a degenerative, slowly progressive deterioration of the nerves in the brainstem's motor system. So gradual onset of symptoms such as stooped posture, so that meaning that the body is kind of flexed forward, a bowed head, I guess, shuffling gait, pill rolling gestures with their fingers, right? And then a mask-like facial appearance. So it's just a lot of shaking, that type of thing. So then we have peripheral neuritis. So this is inflammation of one or more peripheral nerves. It affects, are dependent upon the particular nerve involved. Then we have poliomyelitis. So this is an infectious viral disease that affects the ability of the spinal cord and brain motor neurons to receive stimulation. So the virus enters through the upper respiratory tract, and then muscles become affected, and then they eventually become paralyzed. So this is something that we are vaccinated against, right? But you do see it because a lot of people that don't vaccinate their kids, I mean, I don't want to get into that debate, but whatever. So you guys, like, it can still be seen, but it's pretty much been eradicated. But I guess it's still around in some places. And then we have post-polio syndrome. So this is a progressive weakness occurring at least 30 years after the initial poliomyelitis attack. So you'll see a lot of people that had polio that, like, they may have to use a walker, or one leg might be shorter than the other, or one foot might be shorter or smaller than the other, that type of thing. Those are very small example of symptoms that come along with polio. And then we have Reye's syndrome. This is an acute brain encephalopathy along with fatty infiltration of the internal organs that may follow an acute viral infection. So this occurs usually in children under the age of 18, often with fatal results, and it's linked to aspirin administration during a viral illness. So aspirin is not really like a good thing to give to kids, right? So aspirin was kind of the cure-all for a lot of years, but it's easier and better and more safe to give your kids like acetaminophen or Tylenol or ibuprofen. And then we have shingles, which is herpes zoster. So this is an acute viral infection. It's characterized by inflammation of the underlying spinal and cranial nerve pathway. And it produces painful little eruptions or vascular eruptions on the skin along that nerve pathway. It's seen mainly in adults. And what it is if you've ever had the chicken pox, right? This is the chicken pox at a later stage. So it kind of lays dormant in your system, and then something will kind of bring it out. And it happens on one side of the body. So it doesn't usually cross the spinal cord, like that midline of the body. It happens a lot of times on the trunk of the body, on the legs, on the arms, things like that. So this is an example of shingles. Okay, so these are all little nerve endings that have come to like a little, almost like a little blister, right? And it's really hot feeling. It's a really, really painful thing. Then we have a depressed skull fracture. So this is a broken segment of the skull bone thrust into the brain. So it's depressed into the brain as a result of a direct force, usually a blunt object. So manifestations depend on the section of the brain injured and the extent of damage to the underlying vessels. And then we have spina bifida, cystica, which is the back portion of one or more vertebrae is not closed normally, and a cyst protrudes through the opening in the back, usually at the level of the fifth lumbar or first sacral vertebrae. It's a congenital defect of the central nervous system, and a lot of like babies are born with spina bifida because that's kind of where it occurs, right? And whenever they're in utero. Okay, question. There have been 3 disorders mentioned so far that affect only peripheral nerves. They are, oh gosh, it gives you a big selection there. So take a second and read those. It is C. So Bell's palsy affects the facial nerves, carpal tunnel syndrome affects the median nerve in the forearm, and peripheral neuritis affects one or more. All right, and then we have meningocele. So this is a cyst-like sac covered with skin or a thin membrane protruding through the bony defect of a vertebrae, and it contains meninges and cerebrospinal fluid. And then we have meningomyelocele. So this is a cyst-like sac covered with skin or a thin membrane protruding through the bony defect in the vertebrae that contains meninges, cerebrospinal fluid, and spinal cord segments. So it's kind of like a hernia. Then we have spina bifida occulta. This is a congenital defect of the central nervous system in which the back portion of one or more vertebrae is not closed, and it can cause a dimpling over the area of the back, but it's closed. So in spina bifida, the one we talked about before, it's usually an opening in the skin. The occulta one it's closed, so there's no opening of the skin. And then we have paraplegia. So this is paralysis of the lower extremities caused by severe injury to the spinal cord in the thoracic or lumbar region. And this results in the loss of sensory and motor control below the level of the injury. So if somebody, has a severe injury to the lumbar region of the spinal cord, then they can become paralyzed. So they don't have function over their legs or whatever, wherever it's at. And then we have quadriplegia. So paraplegia is 2, right? So that's meaning kind of your your extremities, so your legs and your arms, right? And then quadriplegia is the paralysis of the trunk, legs, and pelvic organs, partial or total paralysis of the upper extremities, meaning your arms. And this is due to a severe injury to the spinal cord between the fifth and eighth cervical vertebrae, which is in your neck. And the level of the vertebral involvement determines the severity of the motor and sensory impairments. And then we have Tay-Sachs disease. So this is a congenital disorder. It's caused by an altered lipid metabolism resulting from an enzyme deficiency. So accumulation of this type of lipid occurs in the brain, leading to progressive neurological deterioration with both physical and mental retardation. And it occurs most frequently in families of Eastern European Jewish origin. And then we have trigeminal neuralgia or tic douloureux. So this is a short period of severe unilateral pain that radiates along the fifth cranial nerve. Um, so let's see. Uh, Heat or chewing or touching of the affected area activates the pain. So question, true or false? Quadriplegia can also be called tetraplegia, which also means four. What do you think? That's true. So, however, quadriplegia is the most common and widely used term. All right, so I'm going to go ahead and stop this one, and then I'll do a second portion, second video. So, see you guys in a minute.